seeing the same steady high number of COVID-19 hospitalizations across our system. I talked about this at our last briefing. Numbers are pretty stable. Of the 550 to 600 COVID-19 patients we're caring for at any given time right now, about 21% of them are requiring the intensive care unit. 15 to 18% of those patients are on ventilators right now, and the patients that are requiring those types of interventions are getting younger, and they have fewer comorbidities than they did earlier in the pandemic. Currently, the average age of a hospitalized patient in our system is 49 years old, and 91% of them are unvaccinated. Those who are vaccinated and have to be admitted to the hospital have an average age of 78 years old. They were often vaccinated early in the pandemic, and they have other medical problems. The patients who are the most vulnerable and most likely to die of COVID currently in our hospitals are those with diabetes, obesity, heart disease, emphysema, cancer, and chronic kidney problems. So this remains a COVID surge of the unvaccinated spilling over onto the vulnerable vaccinated. And I'll repeat that again. This remains a COVID surge of the unvaccinated spilling over onto the vulnerable vaccinated. Yeah, so we've noticed it as well. It's interesting. It hasn't quite seemed like the peak yet. It's almost like we've hit this plateau. So our inpatient census has been fairly stable for a few days now. So we certainly like that because it's not continuing to go up. And some of our more recent models suggested that it could. So we're hoping that's a plateauing and then eventually a peak, and then certainly heading back the other way. I think this is such a contagious variant. Delta variant is just running through communities, and I think that's adding to more and more people in our communities who now have antibodies, and so hopefully we are seeing that peak and moving back the other way. It remains to be seen if that's going to continue. Certainly, schools opening may have an impact on that, and like we've said before, all of us have antibodies in our system against the viruses that cause the common cold, and eventually everyone, unless you live on a desert island alone, will have antibodies to SARS-CoV-2, the virus that causes COVID. So you're either going to get those antibodies through in a controlled way through vaccination, or you're going to get antibodies from getting COVID and taking your chances with that. So in terms of how that affects our numbers, the more and more people get vaccinated will have antibodies. And unfortunately, the individuals who get COVID that could have been avoided will have antibodies. And over time, we'll get enough immunity in the community to get those numbers down. So I agree with you. I hope we're starting to see that crest and that plateau. But as we've learned through the pandemic, this virus is a way of surprising us, and so we remain vigilant.